Hey guys, be sure to like and subscribe. We have a great article here today, and it's put out by an organization called usmedicareph.org, and it's an organization that's fighting for Medicare in the Philippines for Filipino Americans, medical professionals, retirees, and community advocates. And I think that expats should join in on this. It does mention retirees, but it doesn't mention expats, and it probably should. I'm gonna put in a call to this organization and tell them that they should also have expats join in on this to fight for Medicare over here. There already is like a little bit of Medicare stuff over here, but it's so small it's almost useless right now. And this here article explains a lot, and I want to read this because this and also this touches on about I talked about a tsunami of people, of expats that are coming over here, and not all of them are expats. Some of them are repatriated nurses and stuff like that are going to be retiring. It talks about this here in this article, and you'll see when I start reading from it. But it talks about the tsunami of baby boomers. That is something like, let's see, they are part of the daily tsunami of 10,000 baby boomers who reach 65 years. I guess there's 10,000 baby boomers reach retirement age every single day. And with that said, we're going to have a lot of retirees coming to the Philippines and expats because of the fact that that's going to be happening. But I want to read this article. It's actually, it was a thank you to President Biden for donating vaccines to the Filipino people. But it goes pretty much into depth. And I'm going to read it. Join us, Medicare, in the Philippines. And this is very important. I want to make sure that everybody listens to this from beginning to end, because this touches on a lot of stuff for us. And this may be an organization that we might want to join. And also, this article, I'm going to put the link also in here. Before I even start, I want to say this. It gives the phone number, the email address, where to write to the Senate and both to the White House, asking them to give us Medicare and stuff like that. And when you hear what this has to say, it's kind of important that we do write. We have 30,000 TRICARE people over here. And we have many, many more other retirees over here. I'm not sure quite how many we have over here in total, but we have a lot of Americans over here, and we also have a lot of Filipino Americans over here. So when we put those two together, and these nurses that are coming back after working in the United States and retiring back over here, we got something going on here that we might be able to fight to get this going. But it shows these people out in front of the White House and protesting to get Medicare over here in the Philippines and throughout the world. So it has portability. And this is really good for us. So I want to read this article. I talked about this yesterday a little bit. They also talk about feasibility study. I think there was one a long time ago that I had read about somewhere else, but it was just a small study, and they said it would definitely save. That's probably where they get their numbers from in here. Okay, but it says, we the Filipino Americans, I'm sorry for that noise, guys. It's a cicada, and it's really, really loud because it's really close to us today. So it's really annoying, but there's nothing I can do about it. You can even hear it in the house, and I don't know what's up with this thing today, but this one's super loud. I guess he knows I'm on video. But anyway, this says, we the Filipino Americans, medical professionals, retirees, and community advocates invite you to join our campaign to convince our American president and the U.S. Congress to allow long-term Medicare benefits coverage to the Philippines. Why? Hundreds of thousands of Filipino doctors, nurses, medical professionals, teachers, and workers immigrated in the 1960s, 70s, and 80s upon invitation of U.S. medical and educational institutions and businesses to fulfill the needs of the American people. He's talking about the nurses that immigrated during that time. And then it says, our Filipino-American immigrant professionals are retiring at a rate of 100 per day. Okay, they are part of the daily tsunami of 10,000 baby boomers who reach the 65 years. Under U.S. law, they can take their Social Security pensions anywhere in the world. However, the law does not provide long-term Medicare benefit coverage overseas, unlike private medical insurance. With decades of work, they have paid into Medicare. Now, this is true for us, too, as expats. They deserve portability of benefits at internationally accredited hospitals and healthcare providers in the country of their birth. I mean, even for people that, I mean, I would even go further with that and say that if we leave, we have the right to that money because we've paid into it as expats. So it's not just for, people that have Filipinos that have worked over there, but it's also for us, But I'm going to make comments during this because I think it's kind of important. I'm going to comment more after. Medicare may go bankrupt in 12 years, according to the 2011 Medicare Trustees Report. Now, that was back in 2011. This might be a little bit of an older article, but it's still kind of cool. News story, has no date on it. News stories every day report the worsening budget crisis facing our government because of the ongoing pandemic, economic recession, high unemployment, reduced tax revenues, increasing health care expenses. Medicare may run out of funds in 2024. Social Security benefits may also face cuts or increased requirements. Actually, this article was done during the Biden administration. I think some of this information might be a little bit old, but anyway, let's see. Is portability part of the solution, it says? Yes, Medicare can save at least 50% in costs if they allow American beneficiaries to be covered in the Philippines. The current annual cost of per beneficiary is $11,743. We estimate that taxpayers will save at least $5,000 per year for each Filipino-American senior who chooses to return to their country of birth and avail of quality health care there. Now, that would also go for expats to come over here, which they're not considering into this estimate. Okay, so it would save even more. So here we go. It talks about the amount. With this estimate of cost savings, if 400,000 American retirees choose to reside in now it talks about retirees. If 400,000 American retirees choose to reside in the Philippines, which it probably would be, the Medicare savings would be $2 billion per year. Okay? This dramatic savings could help meet our U.S. government's investments in job creation, education, infrastructure, small business, or reducing the budget deficit. Okay? And then it goes further into saying, can this be done? There are precedents. U.S. Citizen residents of Guam, because of proximity, are allowed to obtain critical medical treatment in the Philippine hospitals that meet Joint Commission International JCI standards. Their costs are reimbursed by Medicare or by private insurance plans. Moreover, the Pentagon's TRICARE and VA departments' health coverage reimbursed 30,000 U.S. military retirees who live in the Philippines. They're talking about TRICARE, and I think they're talking a little bit about FMP in there a little bit, but they didn't mention FMP, the Foreign Medical Plan, okay, for veteran, disabled American vets, okay? And the goal in 2021 and 22, our goal in 2021 and 22 is to obtain a Medicare portability feasibility study, okay, from U.S. Congress on the cost savings with PH healthcare industry based on their past 3 years' experience and the quality of care provided to 30,000 U.S. military retirees in TRICARE and VA Philippines programs and 30,000 Guam Medicare beneficiaries who are treated at top PH hospitals at low prices. So they're talking about Guam. Now, Guam is a U.S. Commonwealth, so that's what they're trying to talk about here a little bit. Okay? And let me see. Get back to this now. We anticipate this crucial study would recommend the extension of Medicare coverage to visiting Filipino-American seniors and U.S. retirees in the Philippines to obtain huge projected savings for the centers of Medicare and Medicaid services and American taxpayers in general. In the meantime, we support the CMS coverage, the CMS current policy allowing Medicare Advantage Part C insurance companies as part of their temporary 6 months worldwide coverage. So you only have temporary coverage to pay directly to top Philippine hospitals and their doctors for treating American visitors on a temporary basis. Let's see. How about accountability to prevent fraud? And we'll get into that. Let's see. These JCI accredited hospitals could demonstrate accountability, high quality of care, standardization of professional fees, and use of electronic health records, EHR. Okay? To meet strict CMS rules, fraud would be reduced to almost zero. Okay, so that's pretty cool when you think about this. If they do this, so this is a possibility, and I think all of us as expats should join in on this. And like I said, I'm gonna give you guys the article, and it gives you the emails to write, and we should all write a letter to the White House, the House of Representatives, and the U.S. Senate, and it gives those contacts here. Okay, so you can write to whoever you want. Okay, it says actions speak louder. With the pandemic and the current crisis we face, our proposal deserves the support of your U.S. President, 2 senators, and Congress member. Email them your views at our websites. Got a bee flying around here. But anyway, guys, I'd like to just say this, that with that said, it says here, ask them to support worldwide Medicare portability to be introduced in Congress soon in the fall. So it is going to be introduced in the fall here, but we have to push behind that. Okay, and I know as expats we're retired and we get kind of lazy, and but I would like to implore you guys to really push on this here. Okay, because if they get 10,000 emails from my people, and I know everybody doesn't always watch my videos every day, so I'm going to ask you guys to send this video out to other people and get people going on this. It does. Also, this U.S. Medicare organization here, it might be something that we think about joining. And they're in Great Falls, St. McLean, Virginia. Interesting place. Now, a lot of these people that are going to be coming back here are nurses. And that's going to be part of that tsunami that I mentioned. And a lot of those nurses are married to Americans. So there's going to be a lot of expat attachment to what we're talking about in this document, okay? So that's a good thing for us. But we as Americans, we need to be thinking about this here, because this is really, really important news that we really push to get this done. And that's really great news that they're actually talking about looking at this in the fall. But if we don't push on this now, guys, it's not going to go through. It'll just die. So let's get our letter writing skills going to these, and email these people out there, or send them a letter or whatever, and get this rolling. But like I said, I'm going to put this in the description so you guys can read it again, and it has all the information in there. Awesome article. And I want to thank Nathan White for sending this in. He's one of our subscribers and a very good friend of mine. So be sure to read this again, guys. Like I said, read over it once or twice, because there's a lot of good info in there. And I'm going to call these people, and I'd like you guys to call them too. And if we can make some donations to them or something, I'm not sure if they accept donations, but if we can push these people to push this through somehow, even if it means sending these people donations, this is for us, guys. This is for Medicare. I've never worked with these people or anything, but I'm going to call them and see if we can get some donations going to these people. And you guys can look up this more. It has the organization here. I'm gonna have my bank send them out a check for like $5 or something like that today, and $5 or $10, and send them out that, or maybe even more, and see if we can get something rolling here. But anyway, guys, God bless. Take care. I hope you enjoyed that today. It is pretty interesting, and if I hear anything more about this, I'll let you guys know. God bless, guys. Take care.